Cervical rib. It is also known as the neck rib. It is a congenital overdevelopment of the transverse process of the seventh cervical spine vertebra. It is usually attached to the first rib, close to the insertion of the scalenus anterior muscle. It may be a complete rib, but more often it is present posteriorly for a short distance only, the anterior part being just a fibrous bend. Structure and function. A cervical rib represents a persistent ossification of the C7 lateral costal element. During early development, this ossified costal element typically becomes reabsorbed. Failure of this process results in a variably elongated transverse process or a complete rib that anteriorly fuses with the T1 first rib below. The cervical rib consists of a head, neck, and a tubercle. The cervical rib has no physiological function. Let's see the types of cervical rib. Type 1 is a complete rib that articulates with the first rib or the manubrium. Type 2 is an incomplete rib with a free distal tip. Type 3 is an incomplete rib with a distal fibrous attachment. Type 4 is a short piece of bone extending beyond the C7 transverse process. Pathophysiology of the cervical rib. The cervical rib narrows the scalene triangle. There is compression of the subclavian artery, C8, and the T1 nerve roots. Angulation of the subclavian artery occurs. This causes constriction of the artery at the site where the artery crosses the cervical rib. Eddy's current created in the blood flow causes sudden release of pressure distal to the narrowing. Therefore, stasis of blood occur which results in thrombosis and further an embolus. The features of ischemia in the hand and forearm results in digital gangrene. Clinical features of cervical rib. Neurological symptoms include tingling, numbness along the distribution of the lowest part of the brachial plexus, along the medial border of the forearm and hand. Weakness and muscle wasting may occur. Motor symptoms include loss of gripping power of hand, tendency of dropping things from the hand, wasting of the palmar muscles, that is the thenar and the hypothenar muscles. Vascular symptoms include cold and clumsy extremities, particularly the fingers, skin color changes to blue associated with trophic changes. There is a rare risk of gangrene and the radial pulse is either feeble or absent. Local symptoms include supraclavicular lump, which on palpation is bony, hard, and fixed. Investigations include X-ray, which may show a well-formed rib articulating posteriorly with the transverse process of the C7 vertebrae. Complications of the cervical vertebrae includes thoracic outlet syndrome, wherein a cervical rib may cause compression of the subclavian artery and the lower roots of the brachial plexus, where individuals complain of pain, paresthesia, and pallor of the affected limb.